The doctor places the gluteal implants in the gluteal areas. We have to place them in the sitting area. Whether a woman's buttocks look beautiful and prominent depends on the position of the implants. Therefore, the doctor has to measure to draw marking lines.
Hello to all our beloved viewers off Channel 14. Welcome to today's talk show about modern buttock augmentation methods and its related topic. And insights from our expert guests. I am Ky Duyen, currently serving as the beauty ambassador for Viet, 𝐕𝐢𝐞𝐿 Plastic Surgery Hospital. And sitting next to me here in studio is a very familiar face from previous live streams. Dr. Chiem Quoc Thai, the medical director of Viet Plastic Surgery Hospital.
Hello everyone, I am Dr. Chiem Quoc Thai. I'm here with Channel 14 to talk about the latest trends in buttock cosmetic surgery.
Today, I'm very happy to join Dr. Chiem Quoc Thai to share with everyone about the most popular trends in buttock augmentation and resolve the related concerns. And Dr. Thai, I think that breast augmentation is no longer Vietnamese most favorite cosmetic procedures. According to recent surveys of both men and women on individual aesthetic enhancing preferences, people seem to prefer having firm, round, and full buttocks. I wonder if the result of these surveys reflect the fact. Can you share your opinions?
In my opinion, I've been doing cosmetic surgery for a very long time and have the opportunity to observe and comparing the cosmetic trend of Vietnam with other countries around the world. From that observation, I can see that Vietnam is always behind global trends. About 10 years ago, worldwide preferences shifted from breast augmentation to buttock augmentation. Vietnamese people's favorite procedures was always breast augmentation during those 10 years. But we're catching up with this shift toward buttock augmentation. Foreign women no longer prioritize breast enhancement. They are focusing on having curved, round, full buttocks that make them sexier and more attractive. This trend has been emerging in Vietnam for the past 2 years.
I am passionate about fashion, so I follow many famous international fashion shows, especially Victoria's Secret shows. I've noticed that the angels there mostly have very moderate or even small breast sizes. But what makes the live audience or global viewers pay the most attention to the attractive points on their bodies is that they have very firm, round, and full buttocks. I think that globally this trend has been around for a very long time, that a beautiful woman isn't someone with a very large chest, but a beautiful woman is someone with round, full, firm, attractive buttocks. From what I understand, to have such beautiful buttocks, they have to go through very strict training regimens and very strict diets as well. I wonder if there are specific methods in modern cosmetic surgery today that are dedicated to buttock beauty enhancement.
As we know, buttock augmentation is very popular in Vietnam. It is also the norm in Asia. That standard of a beautiful woman meant that she had beautiful breasts, a small waist, and curved, beautiful buttocks. In the West, they don't really care about breast size, but in Asia, breast size is very important. Asians still haven't given up the idea of ideal breasts, but now they've developed an additional trend that when combined together, the ideal woman body would look like an hourglass figure, or the S letter, having beautiful large breasts, a small waist, and curved buttocks. That's an Asian trend. Even now, in Japan or South Korea, they also like both buttocks and breasts to be balanced and beautiful, so when women observe that their breasts are large but their buttocks don't match up, it makes them feel less attractive. The current trend is shifting toward having both beautiful breasts and beautiful buttocks. Now, there are many advertisements on different buttocks augmentation methods, but there are really only 3 methods. The first method is combined with liposuction, taking the person's own fat and injecting it into the buttocks. The second method is placing gluteal implants, just like the case of breast augmentation.
So there will be many different implant type and implant sizes. What is the remaining method?
The third method is using filler injection with the same high-quality medical-grade filler that used for nose and chin.
So there are many methods for buttock augmentation. We have even more options than breast augmentation's case, right? Because I only know one method for breast augmentation, which is using implants. But for buttock augmentation, we have 3 methods: autologous fat transfer, implants placement, fillers injection. So now, we'll go through each method one by one to make it easier for the viewers to understand. We'll analyze the advantages, disadvantages, and other factors so our audience can understand better. Let's start with the first method, Doctor, could you tell our viewers about the advantages and disadvantages of the first method called autologous fat injection, and what does it involve?
I would like to correct that the number of methods for both breasts and buttock augmentation is the same. We can also use autologous fat, transfer, and filler injections for breast augmentation.
Oh, so there are other methods too, but the most common choice is implant placement, so the other two methods are not well known.
Correct? For breast augmentation, placing implants is the best choice. For buttock augmentation, the optimized option is fat transfer combined with liposuction. Let me give an example. If the client has a very large waist that makes her body look like a loaf of bread, I'll extract the belly fat using liposuction technique and transfer that fat to her buttock. Then she will have a very small waist. In many cases, liposuction helps reduce the waistline from 70 centimeters to 58 centimeters. Then I'll inject all that fat into her buttock. The more fat that client has in the first place, the more I can inject. In these scenarios, we can increase the buttock circumference from 80 centimeters to 100 centimeters.
In conclusion, the fatter the client originally be, the more benefit they get from this method.
That is correct. But the maximum volume of fat that we can inject for each side of the buttocks is 300 cubic centimeters.
So the maximum volume is 300 cc for each side. Which body part can we extract that amount of fat from? The abdomen, the thighs, or others?
Usually, the stomach. Let me give you an example. To extract,
in the case we need 300 cc, how big should the waistline be?
From my experience, a good candidate for this procedure is a client with waist circumference has to be 65 centimeters or larger.
Oh, 65.
Only then we have enough fat to extract and inject.
To clarify the previous question, if we want to get 300 cc of fat to inject into our buttocks, how big does our waistline have to be considered having enough fat?
Let's say a person has a 65 centimeters waistline. If her lean mass waistline is 56 centimeters, then she has more fat than I need. But it is not sufficient when that number is 60 centimeters.
In conclusion, the amount of fat depends on both body composition and individual's physiology as well as the body weight.
I'll determine the exact amount based on each client's case. The combination of liposuction with buttock fat transfer is absolutely wonderful. You need to understand that achieving beautiful buttocks aren't just about increasing thigh size. It's about having the right curves. Like an hourglass figure, we want it to curve inward at the waist, then curve outward toward the buttocks. Using liposuction and fat transfer, we can sculpt the body to achieve these optimal curves. Where we need the contours to curves inward, we remove fat, and where we need volume outward, we inject fat. Internationally, this combination of the two technique is recognized as body sculpting for women.
So we suction fat from areas that should be smaller, and we inject fat into areas that need volume.
Exactly. So if the client wants an hourglass curve, we'll suction from the areas that need to be leaned. And for areas that need to be larger, such as the hips, we inject fat into those areas to make them wider, if she likes curves from behind. We inject into the hips. That is why liposuction with buttock fat transfer is wonderful.
So we have two advantages for this method. The first advantage of autologous fat transfer is that we can remove abdominal fat to inject into our buttocks to make them bigger. And the second advantage is that we can reshape hip areas according to our desires, targeting specific areas where we want bigger or smaller proportions.
The goal is to create a balanced figure with appropriate size and curves. We graft the client's waist and butt until achieving the desired look, which is just like an hourglass. The third advantage of liposuction with buttock fat transfer is there's no need for recovery time. Clients can sit comfortably the day after the procedures. With implants placement option, the client can't sit or lie down for 2 weeks. But with liposuction and fat transfer, the day after the procedures, the client can move around comfortably.
But the client has to wear compression garments just like breast augmentation cases.
That's right, and they can lie on a side, lie on their back, or sit comfortably because that's their own fat. That's how wonderful it is.
Since the fat was extracted from the tummy areas or within the body, and the method is just moving them around from one areas to another, is there any process for us to maintain it in our body so it doesn't shrink? Because many people want to be slimmer and more beautiful, so if they lose weight by exercising or having restrict diet, will that process affect the parts of the body that already be injected?
Of course, when we lose weight, we lose fat on the entire body comprehensively. But the fat transferred to the buttocks that are extracted using liposuction has a wonderful advantage. That is, when you gain weight, it thickened and increased the size of the buttock first. Isn't that every woman's dream? After the procedures, clients' fat accumulates at the buttock first and then the stomach, because the fat we injected also contains the memory cells. These memory cells make our body think the buttock is the stomach. The principle is when our body consumes food, we normally accumulate fat in areas around the memory cells, which was the abdomen originally. After we move those cells to the buttocks, the body prioritizes fat accumulation in that areas. My clients often have this same respond, "Doctor, why does everything I eat seem to go straight to my buttocks now? Is this okay?" Well, it's perfectly fine. It just makes them become even more beautiful. From my experience of using this method, the results have been wonderful because of this amazing advantage.
What should we expect regarding the buttock softness and natural feeling when we touched it?
Absolutely wonderful, just like real buttocks. And what's its advantage? After liposuction with buttock fat transfer, if you are a man who touches his woman's buttock, you feel exactly like real buttocks, completely like the one that grew naturally, with no artificial feeling because it's her own fat. The fat just goes into all the muscle areas and buttock regions, so when her partner touches it or does anything, he will be amazed. I often heard that my client received compliments such as, "Wow, what a beautiful bottom." If she doesn't talk about the procedures, nobody would know. Even if I performed it, if I forgot her and met her again, I wouldn't know either. I couldn't tell the difference between that buttocks and a natural one.
Up until now, we've only been talking about the advantages. There is a lots of them, right? But does this method have any disadvantages?
There's actually one more advantage. It is actually sustained for life, because the buttock area has lots of muscle and very dense blood circulation. Just like when we discussed breast augmentation earlier, and you asked why people rarely used fat injection for breasts. Because the buttock area has way more muscle that helps keep and sustain the fat. Those fat will be there for life. The fat is permanent. When you lose weight, your entire body loses weight, including the buttocks areas. But when you gain weight, that fat area starts developing first, so it returns to normal. So its advantage is that it never disappears. For breast areas, when you choose breast fat injection, the chance is 50-50, but the buttocks fat injection method has a 100% success rate. That fat never disappears. Then it takes no recovery time after sculpting the body into a beautiful one with beautiful buttocks. Third is when you eat. You don't gain fat in the abdomen first anymore, but in the buttocks. Fourth is,
I guess the buttock fat stay permanent.
The buttocks fat never disappears. And there's only this one disadvantage. There are clients who come to me to perform this technique after seeing their friends' amazing results, but they do not have a sufficient amount of fat for me to inject. That is, its only disadvantage so far.
So its only disadvantage is just like what I mentioned earlier in this live stream. Anyone who wants to do this method has to be quite overweight to benefit from it, right?
That's right. Some clients tell me, "Doctor, I'm going to gain fat." What does gaining fat mean? It means eating comfortably. Sometimes they have to eat for an entire year before having enough fat for me to inject. If you have enough fat, this method creates amazing results. Beautiful lateral-looking buttocks that nobody can tell the difference. That's just one side of the argument. Do not forget the disadvantage. The client must have enough fat. Some women try for 3 years and still can't gain enough fat. Then we will consider their remaining methods.
So for this first method of liposuction and fat transfer to the buttocks, Dr. Trai and Ky Duyen will have an example for all Channel 14 viewers to see what the results of this amazing method looks like. And we have a living witness here who is also one of the doctor's patients who just had the procedures a week ago, as she is now present in the studio with us. She'll come here so everyone can admire how beautiful the doctor's beloved work is.
This client came to me for consultation when her weight was 65 kilograms. She is really depressed due to her fat figure and a large 68 centimeters waistline. Her overall body is very fat, but her buttock measurement is just 87 centimeters, creating an unattractive bread loaf-like figure. So I ask if she wants to have beautiful buttocks and a small waist like the one she used to have. She mentioned that her waist used to be 58 centimeters 3 years ago. So can we achieve that? For me, achieving a 58 centimeters waistline is easy with liposuction. I confirmed to her that I will give her back the 58 centimeters waistline. I won't accept a deviation from that number, such as 54 centimeters. I highly require accuracy in my own work. I give her back the dream 58 centimeters waistlines by extracting the fat and transfer it to the buttocks. So, after I finished the procedures, from a 68 centimeters waist and 87 centimeters buttocks, she became 58 centimeters waist and 100 centimeters buttocks.
Wow, 100 centimeters buttocks, that is an unexpected number.
Even though we achieved such a beautiful body for her, I still wasn't completely satisfied with the results. The reason was that I advised this client to perform a full-body liposuction, but she insisted that only her back and stomach will get the liposuction treatment and leave her shoulders and arms areas untouched. After all, the results is absolutely beautiful. But the arms and shoulders haven't been suctioned yet, so I have this question about the scenarios where I had suction. Those areas too, I would have created a sculpted masterpiece.
I actually have a different opinion. I think some people still want to keep their body to look chubby a bit, for some people. That's what's beautiful body look like, and it is also cute. So they only want to make their waist smaller, but for the shoulders, arms, buttocks, or thighs, they want to keep them a little plump and better untouched. Okay, so we don't keep our viewers waiting any longer. I'll invite her in now, please come in. Wait a minute, this is your employee, am I right? I remember that the last time I came to the hospital I saw her, she was very fat and having a really big body. But today I honestly can't recognize her at all. I am still amazed because of what a little waist. What a firm butt.
Here now, I'll discuss about the postoperative buttocks. Can you stand here so I can explain?
Okay, so it's a really beautiful bottom. But now I think Dr. Thai will introduce the detailed process to our viewers steps by steps. You'll tell the viewers watching the live streams. How did you perform the liposuction for her, and then how did you inject it into her buttocks?
This person was very bulky and had an extremely large waist and accumulated fat on her back, since she just had the procedure a week ago. There are 2 scars from the liposuction performed on her back. If we performed belly liposuction alone, we wouldn't have had these scars, but her back had considerable fat. However, she still has a bit of excess fat beneath her skin and arms.
She should have had treatment for those areas,
as she just preferred not to remove fat to enhance roundness. I'll just perform liposuction on the back, abdomen, and waist. Do you see how I've shaped it? It has a nice curve, just like hourglass figure. If we wanted to enhance it, we could. Also work on the arms and other areas, but it's already beyond perfect. For a woman, I believe this is very alluring. The scars will fade over time. In about a month, these 2 from the liposuction on her back will diminish significantly. You can notice how much fat her back had before.
So, for the entire back area, there are just these 2 small holes. In the case she wanted to have liposuction on her 12 arms, where would the scars be?
The scars would be placed discreetly inside the arms, under the armpit. With the liposuction, this woman's waist has gone from 68 centimeters to 58 centimeters, which is a noticeable change. Beyond having such a small waist, this lady's hip was 87 centimeters. Her buttocks circumferences, somewhere between 99 and 100 centimeters.
We can round it up.
I've only allowed her to begin exercising after 1.5 months. Once she builds muscle up again, her figure will look even more attractive. Will she need to be on a diet? No, she won't, because she needs to eat so that the fat will continue to develop in the hip.
If she overeats, will the fat go to her stomach?
When the fat in her buttocks increases by another 2 centimeters, only then will it start accumulating in the stomach. Here's a helpful tip. When you notice your pants becoming tight, start restricting your diet to maintain your ideal shape. It's like a warning system for you. You might not notice when your stomach is getting larger, but you'll immediately know when your buttocks are getting tighter. That's when your pants become completely snug. What's great about liposuction is that after 1 week, she can move normally and walk normally, and when you touch it, there's no pain at all. Go ahead and feel it, Zion.
Wow, this is such an incredible beautiful bottom. Now, just for the record, I'll take a moment to touch it and see if the sensation of the fat transfer to the buttocks feels natural.
There is no pain now. Press it as hard as you want.
It feels so tight, so I'm scared.
Its firmness and look feels just like the butt of someone who exercises her lower body a lot.
To be honest, when I touched it, it felt completely natural. It resembles the butt of someone who is very dedicated to their workouts. Like those women who have 5 leg days a week. It doesn't make me feel like an implant placed in there. There's no unnatural sensation at all.
It's incredible. As I mentioned, if someone asks me how to achieve a beautiful butt, I always recommend that they need to eat more to gain fat, which I can extract using liposuction and then inject into their buttocks. This way, you can have a gorgeous butt that lasts without the need for further procedures.
Wow, this cosmetic procedure is completely new to me, and as I observe a patient of Dr. Thai, I'm truly impressed. Firstly, it effectively reduces the waistline significantly by removing the excess fat, and after that, the fat that's extracted, the abdomen, waist, and back areas is transferred to the buttocks, creating such a wonderful, round and firm bottom.
It's still slightly bruised since she had the procedure done just a week ago.
It's quite a slim waistline, resembling an hourglass shape.
And this waistline will become even thinner in another month.
It's going to become even more thin. It's likely around half a hand span.
The waist is becoming smaller, and this woman keeps asking me, "Doctor, now that my waist is so small, do I look balanced?" The smaller your waist gets, the more beautiful it looks. I believe it's already perfect, right? It's fantastic. And cause no pain at all. Overall, the modern liposuction techniques are incredible. The ultrasound waves don't hurt at all. There's just a bit of bruising and only some scars left from the procedure. Thank you once again.
Thank you and congratulations. You've had the kind of body that many girls aspire to have, and to be honest, every single time I look at Dr. Thai's masterpiece like this patient's here, I have to admit that Dr. Thai is a very talented cosmetic doctor and a skillful surgeon when he had sculpted such a wonderful and comprehensive hourglass figure body like this. So now let's talk with this patient to see what her feelings are after getting such a wonderful transformation that helped boost her attractiveness. Okay, can you please turn around? Hello, can you please introduce yourself?
I am 𝐃𝐢𝐫.
Okay, first of all, I want to congratulate you once more time on getting such a wonderful body. That's the dream of so many girls and women around the world. I have so many questions to ask. The first question I want to ask is, how did you feel after the procedure? Did you experience any pain during or after the procedures and up until now? Do you feel that your body has improved in certain aspects? Are you completely satisfied with this new look comparing to before you get the procedures?
At first I thought the surgery would cause a lot of pain, but after going through this procedures, I feel that it wasn't like what I thought. The procedures is very gentle and I actually felt very comfortable. I've only had it done for about exactly 9 days, but I feel that my daily activities are still normal. I don't feel pain or discomfort anymore.
So it only hurt from the first day after procedures, but starting from the second day or maybe the third day, it didn't hurt anymore. And now it's completely gone, right?
That is correct.
That is correct. So now that you achieve such a smaller waist and a bigger, more attractive bottom, do you feel happier and more confident on yourself? And did the results match your level of expectations?
Yes, I feel very happy. The first thing I did after surgery was I had to change all my clothes.
Oh, you have to change all your clothes, those clothes that used to be tied around the stomach area. Now you have to give them all away because your waist is too small now. So they'll be much looser, right? What about jeans? Now you have to change all your pants to bigger ones?
Yes, I have to buy a larger size, but sometimes this strange phenomenon occurs. My belly area is loose, while the hip area fits just right.
So it must be really challenging to find clothes that fit a small waist measured at just 58 centimeters. But 100 centimeters hips, isn't it? You will probably have to get tailor-made clothes later. And Dr. Thai, how do you feel when you see the transformation in your patients when you achieve such a masterpiece? Are you truly satisfied with this result?
Let me share a funny story about my work in cosmetic surgery. I often have similar interactions with almost all my clients. They often asked, "Doctor, please give me a very small waist and very big hips to make me beautiful." Then I responded, "Okay, that's very simple for me. But here's the funny part. When I finish, they all come back with the exact same complaint. Doctor, why is my waist too small and my hips too big? What do I do now? I can't find any clothes that fit." And you know what? I absolutely love hearing that complaint. It's the most enjoyable part of my job as a cosmetic surgeon. They ask for a small waist and big hips, and when I deliver exactly what they wanted, they're shocked by how spectacular the results are. Working with these patients makes me so happy because I feel like I'm truly fulfilling my role as a cosmetic surgeon. Those are wonderful experiences.
So we've just clarified all the questions and concern about buttocks augmentation. using autologous fat transfer method, but as Dr. Thai mentioned earlier, this method has a drawback for the group of patients who don't have enough fat or those with a thin, slim body type. We simply can't use this approach because of the lack of fat. So besides this method, we actually have a second option, which is using gluteal implants to place inside the buttocks. Now let's talk about this method. Doctor, could you tell me as well as all our viewers who is watching the live streams all the specific details about the advantages and disadvantages of this specific implant placement method?
I always recommend that when patients have enough fat, the first method is definitely the best, no question about it. Only when there's insufficient fat do I recommend the second method, which is gluteal implants. Now, gluteal implants have their own advantages. First, once we place the implants, they don't need to be removed. They're permanent, lasting 10, 20 years, or even lifetime. Second, we can control exactly how prominent the patient wants. If they want bigger buttocks, we can adjust the size accordingly. Third, there are different types of implants available. For example, if a patient likes higher projection in certain areas, we have round implants for specific projection points, and we also have oval implants. The oval implants are great because when we place them, we can rotate them in whatever direction looks best. If a patient says it prefers this certain look, we can orient the implant to follow the natural contours of the buttocks for the most beautiful result. Everyone who gets gluteal implants always asks me the same question: will the implants affect sitting? The answer is no, because when we place gluteal implants, we position them above the sitting area. When we placing gluteal implants, we place them in this region because what makes a woman's buttocks look beautiful and projected is enhancement in these areas. When I mark the areas, I use the sitting crease as a boundary guide, and we place the implants above that line. The great thing about oval implants is when a woman wants your profile in a specific area, we can rotate the implant to achieve that, and it does not affect when you sit, because you'll never be sitting on the implants.
So Dr. Thai has just shown all our viewers exactly how to position gluteal implants when we use this method. I'd also like to thank our patient for taking the time to join us today in this live stream and helping our audience gaining better understanding about how fat transfer combined with liposuction work and how implant placement is done and their effectiveness for buttock augmentations. Thank you so much. And I want to wish you all the best lucks with such a wonderful transformation. I'm sure you'll find even more success in life and continue to grow happier each day. Thank you so much.
The advantage of gluteal implants is that we can adjust the implant size, shape, placement, position, and angle to achieve exactly the size and projection that the patient desires. But what's the disadvantage? The downside is that patients need to take a 2-week recovery period after the procedure. The patient can lie down in any position, as long as it is comfortable, but they cannot sit normally. If they want to, they have to buy a special cushion with a hole in the middle, like a donut cushion. They have to bring it wherever you go to sit on it during those 2 weeks.
They have to sit like that so the implants' position do not shift while waiting for the buttocks to recover.
Right? So after 2 weeks, they can sit normally again. The second disadvantage is that the incision is located near the anal area, so there is a possibility of infection. The infection rate is about 1 to 2% if the patient failed to practice proper hygiene following doctor's guideline, so buttocks implants placement methodist has those drawbacks.
I have a slightly sensitive question related to your explain. Considering the scenarios of someone just had buttock augmentation using implants placement surgery, and the incision is located near that area, what happens during the recovery period? If they need to go number 2, do they have to hold it? Because if they don't, won't it affect the incision?
No, the incision is positioned about 2 to 3 centimeters away from that area, so there's no impact at all.
So it's normal.
Completely normal. The important factor is to keep proper hygiene around the surgical site. During the procedure and post-operative care in the hospital, the nurse will clean the site carefully, and before going home, our doctor and nurse will give detailed guidance on how to clean the surgical sites. Don't worry.
Are there other disadvantages our viewers need to know?
The mentioned disadvantages are the possibility of infection and discomfort, intervening with routine during the first 2 weeks. After that, for patients with thin muscle and huge implant size, there is small risk of having visible.
I have actually seen many cases of visible gluteal implants before in real life. What happens in those cases is that you can observe an outline on the surface of the buttocks. so you can clearly see the implant when sitting or moving in certain positions or doing exercises.
That visibility issue has two main causes. First is when patients want sizes that exceed their body's capabilities. Some patients insist on using 350cc implants when the maximum size for their anatomy is only 300cc. The second cause is surgeon skill and technique. Some doctors use subfascial implant placement, which causes implant visibility. If you choose an experienced surgeon who uses submuscular placement and appropriately sized implants, this won't happen.
So in summary, this second implant placement method is appropriate for patients who don't have enough fat to be extracted using liposuction and transferred to their buttocks. Personally, I think this method has many advantages, such as being able to choose the appropriate implant size, shape, angle, and position that help achieve the desired look that the client prefer. In contrast, there are also disadvantages that really make you think twice, as what Dr. Thai have mentioned. So for any woman considering this method, you absolutely need to find a reputable medical facility or seek out a surgeon with extensive experience and credibility, since this is one you mistrust with your body. In our previous episode, we discussed all topics related to the different types of breast implants. So for this episode, I have a few questions for Dr. Chiem Quoc Thai about buttock implants, which are, how do we categorize the different types of buttocks implants? And in cases where there's strong impact or sharp objects hitting the implant surface, will these implants be affected? Could you demonstrate as contact for our viewers watching the live stream?
Buttock implants come in many different types. As I mentioned, with all these varieties, I counsel each patient on the different implant options to match their individual preferences. As for implant safety, my recommendation is Motiva implants, which have the most wonderful attributes. All buttock implants come in many types, and inside they contain excellent medical-grade gel. And this gel is a cohesive gel.
Why do I feel like 𝐃𝐢𝐫𝐿? This one is a bit softer.
No, their projection are different in fact. They're not really soft. They have a certain firmness, due to the different requirements due to which body parts that the implants is placing upon. The buttocks implant's density is actually firmer than breast implants. So you see this gel. If I open the jar and turn it upside down, nothing happens. Even when I shake violently, nothing gets leaked.
Everyone, please notice that this gel is what's inside these buttock implants. I'm turning the jar upside down and shaking it as hard as I can in the moment. And there's no leaking at all. Even though this gel is very soft and fluid-like, it doesn't come out one bit. Now I think we're coming to the most exciting and interesting section of this live stream, which I guess every viewer have been waiting to see. In this section, Dr. Thai will showcases the implant durability by creating some very strong impacts using tools like hammers or small and sharp objects like needles or knives to test this implant and see how gluteal implants react when subjected to these kinds of forces. It is your turn now, doctor.
As everyone knows, buttocks experience a lot of impact in daily life, from sitting for long hours to riding motorbikes on bumpy roads where you're constantly bouncing, to intense workout routines with squats. All of these create tremendous force on the buttocks. Now, I'm going to demonstrate how durable gluteal implants are. I've brought a machine. As you can see, this is a professional massage device used by athletes and professional athletes. It has a very powerful motor. Take a look. When this hits muscle, the muscle will shake violently, you see. It's very strong.
Oh, let me try it.
I'm doing just that.
Wow, it hurt.
From your experience, you can tell that this is a very strong machine. So I'll place it here. You see? The machine emits such a very powerful force. Imagine if you had another layer of musculato protect this implant. Let me try again. Not even a scratch. The shell is extremely durable. Even these strong force that help soften tight muscle of professional athletes cannot damage the surface. Not even a scratch.
Now let's try something heavier that can generate stronger force. Let's use the hammer.
So before, I use the hammer for demonstration. Let me place this cover to protect the implants just like your muscle layer and skin layer in your body. This help imitating a real buttock. Let's use this hammer.
Wow, oh my god, I can't imagine anyone would actually hit my buttocks with a hammer like that. Wow, there's really no problem at all. Everyone, it's still brand new, like just coming out of the factory.
See, no woman would ever get hit with a hammer like that. And this isn't just a regular hammer, it has spikes on it.
It is obviously that in real life, no one would ever use a hammer to hit someone's buttocks like that. But Dr. Thai is testing this to show everyone the durability and flexibility of these implants.
As I mentioned, for the next test, I'll use an injection needle. I'll stab this implant many times and you'll see the gel doesn't leak out.
Let's see, now Dr. Thai will use the needle.
The needle goes through the other side. You can see it on the other side, right? Squeeze it.
Wow, oh my, there is no leak. That is so cool. A small and sharp object like a needle stabbed went completely through to the other side of the implant, but when I squeeze it like this, not even a drop of gel leaks out.
Because it contains cohesive gel, and the shell has 3 layers that slide over each other. So when you create a hole on the implant, the layers slide over and seal it.
This means if anyone who gets gluteal implants experiences some unexpected accident, for example, if a sharp object penetrates their buttocks, there's absolutely no risk of the implant leaking or bursting. Wow. Alright, now let's try the most extreme test. Let's use a knife to cut it and see what happens. Here it is, everyone. This is the gluteal implant after Dr. Thai used a very sharp knife to cut it completely in half. You can see that the gel layers inside don't leak out at all. No leaking whatsoever, even in a case where it gets completely severed in two, it will just separate into these 2 pieces. It won't leak out or have any fluid substances flowing out at all.
That's the safety aspect shown right there. See?
When I apply harder force to pull these half apart, this gel layer doesn't leak out. It stays completely in its original state. If the implant gets cut, it just separates into 2 pieces. And it stays in a completely normal state without any liquid leaking out. Just like what I am showing here, this is truly amazing. And when I personally witnessed the doctor doing similar experiments with breast implants in previous live streams, I found these gluteal implants to be even more remarkable. And certainly in real life, no one would ever have someone stab their buttocks with a needle or hit their buttocks with a hammer or even use a knife on their buttocks. But having the doctor here today testing the actual implants that would be placed in a patient's buttocks in those extreme unrealistic scenarios, I'm truly amazed by this results. The demonstration shows superior safety, and you still having concerns about placing gluteal implants, you must be convinced by such an impressive experiments. They are completely safe, don't worry.
Absolutely safe.
Now we'll move to a section that I think contains very useful information for women who are considering gluteal enhancement using implants. These information may be the decisive one for this specific implant placements method, which requires surgery. What are the restrictions and what health conditions should patients be aware of? Could you share the information that address these concerns with our viewers, doctor?
As I mentioned before, the process is quite straightforward. You come in for tests, have the procedure, then rest without doing heavy work for a month and no sitting for 2 weeks. You can lie down and stand normally during this period. You can eat normally and go to the bathroom as usual. The only concern is being very careful with hygiene and following the instructions from nurses and doctors carefully. Then you'll be fine.
So Dr. Thai and I have just shared with everyone all the information about the 2 methods for gluteal enhancement, including both their advantages and drawbacks. The first method uses autologous fat transfer, which means that the doctor extract the belly fat using liposuction and inject those fat into the buttocks. The second method uses implants, which can be placed inside the buttock to achieve the desired look. But there's a third method using fillers. I wonder if Dr. Thai could share with everyone about this third method. Who should use fillers? For example, fat transfer is for patients that have excessive fat, or those who are a bit overweight. For the second method, people with thin bodies who don't have enough fat would use implants. But for this third method using fillers, who is the appropriate patients?
The third method is for people who don't have enough fat and also don't want surgery. So the third method is non-surgical. The advantage is that it's non-surgical, but it has many disadvantages. Firstly, they are very expensive. For example, 𝐃𝐢𝐫 proper gluteal enhancement with HA fillers that last 2 to 3 years. It costs about 300 million Vietnam dong. That information is not coming from my experience alone, but also scripted in all the official manufacturer's guidelines. It's only 2 to 3 years, usually 2. So for beautiful buttocks that last 2 years at 300 million dong, I think that's too wasteful. If there are beauty centers offering permanent filler injections, That is not filler, but silicone, and it have many involved risk. Never accept those offer. If you want the cheapest options, which is using Korean Ha fillers that cost around 1 million dong for 2 years, effect, but the legitimate world-class products from Europe and America cost 300 million dong. And that's also only 2 to 3 years. The cost is too high for such a short period. But it fits some people's preferences though. They decide to get gluteal implants later.
Exactly, because when it comes to detailed of beauty treatment methods, both fat transfer method and gluteal implants placement method requires surgery. And some patients freak out when they hear that key word, but if they have the financial means, they'll use filler injection instead, for example with Korean Ha fillers. So generally, each method has its own advantages and disadvantages. What about the cost for fat transfer and gluteal implants, doctor? Could you share that with everyone?
So with liposuction and fat transfer to the buttocks combined, you get a beautiful body that is sculptured based on your preferences. For a price of only 100 million Vietnam dong, you get a permanent updates with both a more appealing buttocks and slimmer waist. For the cases of gluteal implants, it cost 80 million Vietnam dong.
The implant cost 80 million.
It improves the buttocks aesthetic permanently. If you want to combine it with additional liposuction for the hips, waist, and other areas to optimize body look, the package price is above 100 million Vietnam dong. Filler injection is a much more expensive option, with 100 millions for 200 cc of Korea Ha product and 300 million for a better supplier like US or Europe.
Actually, when I hear these prices that range from 100 million to 300 million, it really is a substantial amount of money. But after spending a moment to think about all the long-lasting benefits and aesthetic improvement, I think this is actually a very reasonable price. And to sum it up, today I want to thank Dr. Thai for coming here and taking the time to share with me and all Channel 14 viewers such incredibly useful information, truly very helpful. And if anyone is considering transforming their body or wants their buttocks to become more beautiful, you should definitely watch this live stream to gain valuable knowledge about all the modern buttocks augmentation methods available today, and get answers to all related questions. And especially from Dr. Thai, who is recognized as one of Vietnam's leading cosmetic surgeons, who stays ahead of the latest global aesthetic trends. I believe that every woman wants to become more beautiful and attractive, but the most important thing is to always choose a reputable facility and select a doctor with exceptional skills, like Dr. Thai here, who can help transform your body comprehensively and safely, and most importantly, protect your health. Dr. Thai and I want to thank everyone who took the time to watch this live stream. And if you want to ask more questions or need additional consultation, you can contact 𝐕𝐢𝐴 Plastic Surgery Hospital. You can make a phone call or message the 𝐕𝐢𝐴 Plastic Surgery Hospital Facebook page. Now Dr. Thai, please say goodbye to beloved our viewers.
Thank you everyone for your interest and for following through this live stream with 𝐃𝐨𝐿 and me. I hope everyone will understand more about modern buttocks augmentation methods and the techniques I've explained in detail. If you still have questions, please visit our website, 𝐵𝑒nhvnvietnam.com, or our hospital's Facebook page. Thank you everyone.
Thank you everyone so much. Goodbye. See you all in our future live streams.